I call Grace Pickering.
Te mana whakawā, ngā mihi nui. In te ao Māori, our hora is depicted by the same whare nui I slept in when I lost a family member to suicide. A whare full of whakapapa, history and tikanga, modelling te whare tapawha. Mr. Speaker, 20% of our rangatahi in Aotearoa are distressed with a mental health issue. Look around koto. In this room full of change, 35 of us have experienced the breakdown of one of the 4 te whare tapawha walls. Mr. Speaker, us as youth are calling out for systematic change. According to the New Zealand Medical Journal, the number of psychologists in ratio to those who would benefit from their treatment is 1 to 312. From building whanaungatanga to multiple consultant sessions, realistically, a psychologist only sees 80 patients a year. This estimate leaves 500,000 of our rangatahi with mental health issues unable to access treatment. Our lower income communities that have a higher prevalence of mental health issues are the same communities that cannot afford to go to therapy, where consultants are too far away from their whare, and they are ultimately a part of that 500,000. Madam Speaker, if the majority of our mental health services are constructed towards those of high income, how are we, as the next generation, being constantly shown an absence of support? There are whānau choosing between putting kai on the table or paying for psychological treatment. Youth who have been on waiting lists for 8+ weeks after a referral. Madam Speaker, if Aotearoa is experiencing one of the highest rates of suicide in fathers, sons, daughters and mothers, how are we, as the next generation, lowering these statistics as a collective? Our lower income communities, our Māori and Pasifika whānau, do not benefit from the funding going into the system if it is not used to make these resources more economically and geographically accessible. Speaker, my kōrero is not to pull us away from the growth of our motu, but to give a voice to present rangatahi, future generations and those who are watching over us from above. We are all on this journey together, and I'd like to acknowledge the mahi that's already been done. But there is a karanga for more. Your voice, your values are not only a portrayal of yourself, but your culture, your ancestors, your whakapapa and your family. Use it to advocate for those who are no longer with us as a result of the system.
Order. Before we continue, I just want to